Hello and welcome everyone. Thank you so much for being here and joining us today for the Synovial Sarcoma Education and Support. This webinar is presented by the Sarcoma Alliance and the Synovial Sarcoma Foundation and sponsored by US World Meds. We are grateful to have you all here with us for this very informative and important conversation. Today's session is designed to provide education, support, meaningful perspective from the patients, caregivers, and everyone who is really trying to better understand synovial sarcoma. So this is our agenda for today. So before we do begin, I'd like to briefly just walk through the agenda of what we're going to be talking about. We'll start with a general overview to help everyone better understand synovial sarcoma. Then from there, we'll move into the clinical perspective with Dr. D'Angelo, who will then speak to us from a medical standpoint from this disease. And then we'll hear from Julie Kramer, who will share her patient perspective and her lived experience navigating this disease. So today's webinar, again, is brought to you by US World Meds in partnership with the Sarcoma Alliance with the Synovial Sarcoma Foundation. For those of you who may be less familiar with the Sarcoma Alliance, we are committed to supporting people affected by sarcoma through guidance, education, and community connection. This session is intended to be for the patients and caregivers, clinicians focus, with the goal of making information about synovial sarcoma more accessible and understandable for us all across the globe. We'll be covering the patient journey, treatment options, and best practices, while also creating a space for real-life insight and practical support. So please feel free to submit your questions in the chat as we go. For anyone who may need to revisit information later, this is recorded, so it will be available on our social media channels, specifically YouTube. All right, so let's jump right into it. So to begin, I want to kind of get us a little bit grounded on the understanding of synovial sarcoma. It's a very rare disease of soft tissue cancer. It is often found in near joints, particularly in the arms and legs, and although it can appear in other parts of the body as well. It is most commonly affected in adolescents and young adults, which can make the disease especially disrupted during a time of life when people are really building their careers, relationships, and future plans. Because it's so rare, synovial sarcoma is mostly understood, and many patients and families may feel overwhelmed or isolated as they try to navigate this treatment and diagnosis. And to help us better understand the clinical side of this disease, I'd like to now introduce Dr. D'Angelo, who will be helping us today, and really excited to hear your perspective on this. So we're honored to have you here, Dr. D'Angelo, to help us understand the clinical perspective of this. In this portion of the webinar, we'll be discussing how the disease is typically diagnosed, how it presents in patients, and then we'll also explore the treatment approaches, how the clinical decisions are made, and then what patients and families may need to consider along the way. In addition to the medical facts, we'll also want to acknowledge the broader impact of the disease, including the uncertainty, emotional strain, and the importance of support care throughout the journey. So at this time, I'd like to turn things over to Dr. D'Angelo. If you could just give us some background about you, how you got into this space, and then we're going to dive in a little bit deeper into the discussion points that we have with the diagnosis, the presentation, etc.
Thanks so much, Brandi. It's such a privilege to be here, part of this webinar. A little bit about myself. I'm a lifelong New Yorker, have lived here all my life, and did my training in various boroughs, and landed at MSK. It's kind of a funny story. When I started my internship, I was supposed to go to NYU to start my internship, and I get to NYU and they told me that I had to go to MSK, and I was like, MSK, why am I going there? I didn't even know that it was a thing. Yeah. And then I made my way to MSK, and they said to me, well, you're actually on night float. You're covering nights for these next 2 weeks, so you actually have to come home and come back at 5 o'clock. And And I did my 2 weeks of night float, and then I spent 2 more weeks on the inpatient side at MSK. And I said, oh my God, I am never coming back here ever again. This place is so crazy and it's so intense and it's so emotional. I could never do this.
Wow.
But it's interesting because I came full circle. I then there was something that gravitated and made me want to come back to MSK.
Mm,
And it became very clear to me what was special about MSK. It was just sort of a combination of, being able to care for patients in this very highly regarded and special patient-centric approach. The patient was at the core of everything we did. But obviously, equally important was the research and sort of the breakthroughs that I saw senior colleagues of mine bringing forward in a number of different malignancies. And at that moment, I said, well, I want to be an oncologist, but I'll only do it if I could train in New York at MSK.
uh-huh.
And so here I am, 20 plus years later. It's been quite the journey, and being part of the sarcoma
Mm,
team, and specifically with my interest in synovial sarcoma and immunotherapy, it's been quite the journey, and it's been fun to be part of it.
oh, I love that. It's so amazing how you found your forever home in this space. And I'm sure just the cancer community is just loving you. So thank you for that. So I do want to talk a bit more about like the diagnosis and presentation of synovial sarcoma. So what are the symptoms of this disease and how do they differ from other cancers and or conditions?
So it's a great question. I mean, because I think it can vary from patient to patient.
Mhm,
And sarcoma, broadly speaking, many times patients don't have symptoms initially, and it's only when they develop symptoms that then they wind up seeking care.
mm,
And the symptoms often are dependent on the location of where the tumor starts, right? So common symptoms can be lump or swelling in the arm and leg,
mhm,
pain and soreness, or maybe if the tumor is pushing on a nerve, patients can have some numbness or tingling or
mhm,
stiffness. So it can be quite subtle, at least until you develop the tumor and it may be big enough to be pushing on something, and then all of a sudden you have pain.
mm,
There are other less common locations, like you alluded to. Sometimes tumors can start in the head and neck, or in the chest, or in the lung, and that can lead to other symptoms as well, like shortness of breath.
mm,
But I
mm,
think importantly, a lot of it just is dependent on where the tumor is and what it's touching on, and that directly correlates with the symptoms. But I would probably say that pain is a common thing that patients can present with. So listening to your body
right.
and noticing a change, I think, is important. One thing I often tell my patients is that, if you have a symptom, all of us will have symptoms. We'll wake up with aches and pains. Usually, if it's something more serious, that ache and pain won't go away,
Mm,
will get worse, may wake you up at night, may require you to take some sort of pain relief, which can even just be Tylenol, Motrin in the beginning. So symptoms that don't go away require attention. I think that's an important point.
mhm. Is there like an underlying cause for these symptoms, or is there genetics that are predisposed that we can consider?
Not really. Not really. Synovial sarcoma is not a disease that we say is genetically inheritable. So it's not something that can be passed down from family, from parents. And there's some examples of that. The most sort of common example is like the BRCA mutation that increases risk of breast cancer, ovarian cancer. This is not a disease generally that we say is like that.
Mm,
Many times we just don't understand why it happens.
mm,
Um, and and again, the symptoms are just based on where the tumor is and whether it's pushing on a nerve or a muscle, and leading to pain and discomfort.
okay. And so when you have the pain, discomfort, and you go to the doctors and they're going to give you a diagnosis, what is the recommendations to find out what the diagnostics is? What are those the techniques, the imaging, if you need that, or is it a biopsy? What does that look like?
Yeah, so usually, depending on the location of the tumor, one of the first steps will be imaging. Like you said, typically a CAT scan or an MRI, depending on where it is.
Hmm.
Once they identify the actual location, the next step would be a biopsy
Hmm.
in order to confirm the diagnosis. And sarcoma is complex in that it's not one disease. There's 70 to 80 different types of sarcomas,
Right.
maybe even 100 types of sarcoma. So it's important that the biopsy is performed and it's reviewed at a sarcoma center of excellence,
Hmm.
because the pathology is really instrumental in really devising the right treatment plan, right?
Right.
Synovial sarcoma has a specific genetic chromosomal translocation. So you can confirm the diagnosis based on the presence of this specific genetic finding. So in many ways, it makes it easier to confirm the diagnosis, but you have to know to check for that translocation. So it goes back to making sure that you seek care in a sarcoma center of excellence.
Right.
Once you confirm the diagnosis, the other part of the workup would be what we refer to as staging.
Mm.
And with staging, it's additional imaging, typically CAT scan of the chest, abdomen, and pelvis to get a sort of more comprehensive view of the entire body to see if the tumor is localized to the initial location. We can just make an assumption, just say arms or legs, or and make sure it hasn't spread anywhere else. Typically, these tumors do like to spread to the lung. So you'll need a CAT scan of the chest, abdomen, and pelvis as well.
Mm-hmm. And once we get the imaging and kind of find out what you're working with, what is the treatment plan and what does that look like? Is it surgery? Is it radiation? Or is it like, case by case and what's most appropriate for that specific case?
Yeah, I think yeah, you make an important point. It is case by case. Every case is individualized and the decision making is often made in a multidisciplinary fashion, meaning, we have surgeons, radiation oncologists, and me as a medical oncologist all sort of regrouping together as a team and really figuring out the best path forward.
Hmm.
Oftentimes, for nearly all sarcomas, the initial treatment plan, if feasible, would be surgery. But many times, depending on the location and if the tumor is bigger than a certain size, then we sometimes implement chemotherapy and
Hmm.
then sometimes radiation therapy. So all of those treatments can be used, but it really depends on the nuances of the location of the tumor, the size of the tumor. And
Hmm.
again, I'll highlight one more time, having a team that's familiar with sarcoma is important
Hmm.
because you want to make sure that the approach is based on knowledge, expertise, and what we say, evidence-based essentially. And so a lot of sarcoma centers do have multidisciplinary teams. So for example, at MSK, I share clinic space with Dr. Singer, who's the head of sarcoma surgery. We also have radiation oncologists that practice on same day. So we're able to sort of devise a treatment plan in the real time with the whole team, which really sets patients up for success.
I love that. So, how do you set up your treatment decision making plan? I know patients are sometimes or most of the time included in that plan, but how do you also particularly balance the efficacy, the side effects, and the quality of life, and then what the patient has to say as well?
So it's so important to engage patients in decision making. It's shared
Yes.
decision making.
Yes.
I think there's been an evolution in medicine, right? In the past, the model was very paternalistic, where people told you what to do and you just listened. But that's not the society we live in, and certainly not how I was trained in my medical oncology training, and nor even how I generally live my life, right? In a
Mhm.
paternalistic model, I wouldn't survive. So there's certain things obviously that we have to leverage
Mhm.
as experts. At the end of the day, we're the experts, and we are trained to set our patients up for success. So I think education is so important, um,
Yes.
and providing knowledge is important. And so there's certain things that are important. So if the tumor can be removed, it must be removed. It should be removed.
Mhm.
If the tumor is in a difficult location where it can't be removed, that's when then you're weighing this sort of balance between, do we use chemotherapy? Will chemotherapy shrink the tumor? Or do we use radiation therapy? Can that
Mhm.
shrink the tumor? So it becomes a multidisciplinary conversation. And what we try and do at MSK is really, we have tumor board where we review each and every new patient we meet in this tumor board, which meets weekly, and we arrive at consensus, our expert-based opinion, right? Based on the tumor, the size, the patient, the age of the patient, what other medical problems they may or may not have. So it becomes an individualized discussion. And I think at the end of the day, patient preferences obviously weigh in. If there's a younger patient who is really not interested in chemo, maybe in that scenario, we can sort of tweak our plan.
Mm.
um, Sometimes it may not make sense to do that though, right? And I think that's where the education piece comes in, right? I recommend chemo because of this, right? And so it is a balance. Listening though to patients obviously is so important, and engaging patients in that decision making is important. And then
Mhm.
leveraging our expertise to educate patients is equally important, right? We want to arrive at a consensus, and we want to
Mhm.
make sure that patients get the best care possible.
Right. And what factors influence the prognosis with these patients, and how do the outcomes vary based on the stage and location of the tumor?
Yeah, one of the biggest things that impact prognosis in sarcoma is size. So the larger the tumor, the more likely the recurrence rate. Um,
Mm.
some tumors in different locations have a higher likelihood of spreading as well.
Mm.
There's a number of different what we call nomograms where we can kind of assess prognosis based on size and location and things of that sort. To be quite honest with you, I find those statistics and prognosis uh, algorithms kind of hard in the context of patient care, right?
Mhm.
Because at the end of the day, a lot of those statistics are based on small numbers. This is a rare tumor, right?
Yeah.
So I am not very dogmatic in leveraging a decision model just based on a decision tree or a decision making just based on prognosis in that manner, right? I think that what we have to understand is certain tumors are more likely to spread because they're bigger. And is it worth pursuing chemo to try and alter that risk, right? And again, there's a lot of factors that weigh into it, and it can't be this sort of black white approach. There's so much in between. And
Mhm.
when we think about also prognosis, I think what's important is that, a statistic is a bell curve, and there's tails in the curve. So I think the extremes are obvious and easy, right? But then there's so much in between
Yeah.
that it's so hard to be so definitive. So I actually value the fact that my decision is always validated and confirmed by 11 other medical oncologists that work with me at MSK, right? Where in the context of this tumor board, and similarly with the surgeons and radiation oncologists. At the end of the day, I tell my patients that I need to be able to sleep at night, right? And if I'm not 100% confident in my decision, I can't sleep. And that means I'm doing an injustice, right? And I would never, ever, ever feel comfortable with that.
Mhm.
Prognosis is important, but it's also um, you have to kind of take it with a grain of salt and not put so much emphasis on those numbers and those statistics, because as a researcher I need those numbers, right, to plan the right clinical trial, to devise the statistics properly. But as a human sitting across the room from another human, I don't like to talk statistics and numbers. I tell my patients from the beginning, I'm like, I'm not going to answer that question.
Yeah.
And you get to know your patients, and you develop a relationship where it makes sense.
Yeah. So are there any emerging therapies, clinical trials, or like advancements in research that are show promising um, progress with synovial sarcoma patients at all right now at this time?
Um, I think the biggest breakthrough over the last few years has been with T cell therapy.
Mm.
We were involved in that effort from the very beginning. The limitation of that approach is that not every patient qualifies because it requires a specific blood type. So while it's an important breakthrough, it's not one that can be broadly applied to all patients. Now, you can think about that a number of different ways. Some cancers out there have genetic changes, like for example, end-track fusions, right? That was an important breakthrough in the oncology field. That's only present in 1% of all patients with all cancer. So again, it's kind of like a needle in a haystack, right? If you have that genetic change and you qualify for that particular therapy. So I look at the progress with T cell therapy in a similar manner.
Hmm.
We are now able to help this group of patients. We still have to figure out what to do for the rest, and it's always like a work in progress. And I'm very optimistic that progress will continue to happen. And the fact that the T cell therapy, the first approved agent, happened in synovial sarcoma, I think is a remarkable testament to the field, to the commitment across all the sarcoma centers, sort of rallying and working together to test this compound and really bring it to the FDA and ultimately get it approved. So I think it's progress.
That sounds very promising. And what type of guidance or advice do you give patients regarding long-term follow-up, recurrence monitoring, or just in general survivorship care after treatment?
Yeah, so it depends on the scenario of the patient and sort of what the extent of their disease is. So for patients that have had a tumor that was removed and they no longer have the tumor present, those patients generally enter active surveillance. To be honest, many times it's the surgeons that will see those patients, right? Because they'll had removed the tumor and they follow those patients moving forward. If I'm involved in their care, their tumor generally probably was bigger and higher risk, and maybe I even administered chemo for those patients. So surveillance for those patients would look a little bit more aggressive, meaning we would get scans a little bit more frequently, maybe every 3 to 4 months.
Hmm.
And then if someone has active synovial sarcoma and we're treating recurrence, then that looks completely different as well. Those patients we follow and schedule our imaging to determine the benefit of the treatment we're using for those particular patients. So it varies a little bit depending on the disease status of the patient.
Hmm. And I know cancer definitely takes an emotional toll on not only the physician, but also the patient receiving and going through this. Are there any emotional or psychological challenges related to the condition, such as anxiety, depression, or like body concern images that you've seen so far in your practice?
There's so much of that.
Yeah.
It's a Cancer is a very emotional diagnosis. I think that in the beginning of the journey for patients, I think the hardest thing is not knowing the uncertainty of the plan. When am I going to have surgery? Do I need chemo? Do I need? So I think one of the things I like to talk to patients in the beginning about is you're scared because you don't know what we're going to do next. And
Hmm.
I at least try and have some sort of plan. This is the path we're thinking about. So I think that's the first part, the uncertainty
Hmm.
of the path. And then the second emotional toll, I would say, is the uncertainty of the intervention and whether it will help or not. And then uh, I would say the third thing in the beginning of the journey is sort of how will I handle the treatment?
Yes.
How will I feel after surgery? How will, so I think the uncertainty is really hard and as humans, generally we like to be in control of things.
Yes.
And this becomes something that you can't control, which is so hard as a human not being able to control things, right? We want to control everything, right? So I would say that uncertainty is probably one of the biggest emotional challenges.
Hmm.
As you embark on the journey with your team, you start to become a little bit more comfortable with the path, right? Because then you're like, oh, okay, I'm going to meet the surgeon and then I'm going to meet the oncologist and this is what we have lined up. And, so I think it becomes clearer.
Hmm.
The emotional toll of having this diagnosis then continues to evolve depending on the stage and the interventions that patients embark on.
Hmm. Hmm.
If it's surgery, then there's one whole aspect that you focus on. If it's chemo, then it's a whole nother thing, right? And when you talk about sort of physical appearance, I think for young patients, one of the hardest things with chemotherapy is obviously hair loss, because then that becomes a physical thing, right?
Yes.
Where people can see that you're getting chemo, right? So I think that's one big thing. And then the other thing is, depending, even sort of shifting back to surgery again, depending on where the tumor is, what kind of surgery are you having, and will that have a physical impact in how you walk and how so it's all very emotional.
Hmm.
I think having a lot of support is very important, family, and also like external professional support, right? I actually like to engage our social worker, our counselors, our psychiatrists. It's not that these people are going to make the cancer go away, but what they can do is actually help provide you with tools to cope with the current status, right? Because we've never encountered a problem like this before. So you just need support to kind of deal with the emotional burden and help sort of guide you in a moment where you feel so stressed and so anxious because you don't know, having a coping mechanism in place to say, okay, I feel like this, and this is what I will do to address that emotion. So I think it's important actually to engage
Hmm.
support, because I think this is a very emotional problem.
Yes. I agree 1,000% with you. Well, I thank you, Dr. D'Angelo, for not only sharing your expertise, but for the work you do every day to advance care and bring so much hope to this community because it's so important. Your insight has truly gaps the bridge for us for the science and like understanding and bring this all together in one kind of cohesive manner. So thank you so much for your insight on that.
Oh, it's my pleasure. It's again, this is a sacred job,
Hmm.
right? It's not just a job. I think I view it as more than that.
Hmm.
And it's very complex, and we need to be empowered. We, as physicians, as doctors, as members of the healthcare team, we have to collaborate and engage our colleagues within MSK, outside of MSK. Obviously, we all have to collaborate, because at the end of the day, I tell the people around me, even the people that work with me, the research staff, the administrators, I'm like, I don't go to work and give less than 100%.
Hmm.
I don't know how. I never was like that, but even more so, I'm like, none of us can come to work when you have a patient's life at your hand and give less than 100%. Because
Right.
at the end of the day, that patient is someone's mom, someone's brother, someone's son, and I say to the people around me, I'm like, and I love all those people in my life. So I'm
Mm.
obligated to make sure that we do right by all those people. So it's an important thing.
Yeah, and I see how passionate you are about that. So very lucky to have you in this community and just oncology in general. So thank you so much for that. So we're now going to be shifting from the clinical perspective to the lived experience because behind every diagnosis is a person, a story, and a journey. I'm honored to introduce Julie Kramer to you all, who will share her experience navigating synovial sarcoma.
Hi,
So,
everybody. Oh,
hi.
sorry. Go
No,
ahead.
totally fine. So welcome. So this is the part where we're definitely going to kind of switch gears a little bit. Um, we're going to hear about your story and your personal lived experience with this disease. So I think it's going to be a little different for some of the caregivers, and some of the patients on the call can hear a little bit your perspective on that. So let's jump right into it. Can you tell us a little bit about who you are, the work that you do, and then we're going to kind of go back and forth with some of the questions that we've initially have already kind of covered with Dr. D'Angelo, and kind of come from a patient perspective with that.
Thank you, Brandi. And thank you so much again, Dr. D'Angelo, for your insight. I appreciate it very much. I am Julie Kramer. For those who don't know me, I am the Community Engagement and Partnerships Manager for the Synovial Sarcoma Foundation. I got involved in, this community back in 2014 when I was diagnosed with stage 4 synovial sarcoma, primary of the lung. The initial diagnosis was a 20 centimeter wide tumor in my chest. I was given 3 months to live and therefore had to get a second opinion at a sarcoma specialist. And I underwent extensive chemotherapy to shrink the tumor to be able to operate on it. And once the tumor had shrunk nearly half in size, I was able to get surgery to remove it with clear margins. I also had my ribs 1 and 2 removed, my subclavian vein, my phrenic nerve, most of my left lung, and I now have a left diaphragm that is paralyzed, which of course, is a slight issue with breathing, but I'm still here. Just takes me a little bit more to talk. And following surgery, I received 36 rounds of proton radiation as precaution, even though the surgery was clear margins. And then after, full 365 days of treating it actively, I was NED, which is no evidence of disease. And then my first 3 month checkup, I found out that I had my first recurrence, which was a nodule in my left lung. And that was treated through a surgical VATS procedure. And then I was okay, NED for 2 years. And then right before I was starting college again, I found out that it came back in both lungs, a tumor in each lung, and one was surgically removed again with the VATS procedure, and the other was treated with the SBRT therapy, which is a very intricate high dose of radiation. And since then, thankfully, miraculously, I have been no evidence of disease for 9 years. And since my initial diagnosis up until now, I've just tried to heavily advocate for those in the sarcoma community, in the cancer community. As we learn on this call and every call that we join, this is a very rare cancer. It needs a lot of attention. It needs a lot of discussion. It needs a lot of research and treatment and just kind of everything thrown at it. So, thank you again for allowing me to be here to speak and share my story and, provide anything that I can for this community. Thank you.
Of course. So can you tell us, I want to jump right in. This is so interesting. And congratulations on your 9 years. I know that takes a lot of hard work and continued dedication and being optimistic. So great job for that. But what was your initial emotions when you first received this diagnosis?
Yes, my initial emotions were just instant shock and disbelief. Truthfully, I couldn't believe that something like this could happen to me, and I think many others might experience that too. You hear about people getting cancer. There was never cancer in my life, nothing in my family history. When I first heard I had a giant mass in my chest, I'm like, okay, give me a pill. Let's get it out of there. I was very naive to what I was about to go through. Um,
Mm,
and then I think, within a matter of minutes, I went from shock and disbelief to fight or flight mode because just my body just locked in and I was like, okay, I need to act quickly. So
uh-huh. What are the biggest challenges you faced during your journey, and how have you managed them?
I would say my biggest challenge was in the initial diagnosis, besides the cancer itself, of course, uh, I did not have health insurance upon being diagnosed.
Oh my God.
So I had uh, I'm very fortunate to have had my mom be, my main source of advocacy. She fought hard and aggressive in order for me to get a second opinion, see the doctors that I needed to see when I needed to see them, do anything she can to make sure that I was covered under health insurance, once I started treatment. And just, it's the cancer diagnosis is one thing, and then there's so many other battles that go with it that
Mm,
to me it seems impossible. I wouldn't have been able to be here without my mom, and I think
mm,
it's important for someone to have someone to help them advocate because it is so much work.
yes.
The treatment and the paperwork and the bills and all of that it really piles up.
Mm,
But I was able to also use my prognosis and this diagnosis as fuel. yeah, so I use that as motivation to lock in and fight. So.
Mhm. Were there specific strategies that you used to kind of lock in and get focused with this journey of yours?
So I did a lot of research, and I know that that can be scary, but I Googled night and day. And like Dr. D'Angelo covered with, prognosis, they are statistics, right? And like back in 2014, there was a lot less statistics with this disease. And
Mhm.
everything I looked at basically said I shouldn't even be here. And I kind of put it as like, what do I have to lose type of mindset. And that's where I kind of like turned that into fuel, where
Mhm.
I really had nothing else to lose. Let me just go all in and, find out about this disease. I wanted to know more um,
Mhm.
because I realized that I'm like, okay, this is something really rare that I have. No
Mhm.
one's heard of it before. And and I think it can be really scary doing research, but I think it is important to stay informed, especially with a rare cancer like synovial sarcoma. It's not
Mhm.
like other cancers. So it's even though it's terrifying to do your research, it is important because it's part of the advocacy and it's part of understanding this disease more and knowing what resources are available to you and knowing that you need to get a second opinion. And of course, all of these things are happening within a few days or a week, and you're overwhelmed with information, but it is information that can, save your life ultimately. And, aside from the terrifying research I read, throughout my journey, I've always just been a very like go with the flow and silly person. So I used humor a lot to cope with everything. And I tried to make sure that when my energy levels were, you know, able to just find laughter
Mhm.
in any day if I could and just trying to remain silly and as normal as I possibly can, going
Mhm.
through something that just felt completely out of body.
Yeah, yeah. It's like you lose control. You're just going with the motions of it.
Right.
I totally understand. So I know your mother was a huge advocate in this uh, part of your journey. Did you have any friends? Was there any community that you went to kind of find more information out, or just kind of camaraderie there at all?
So community was very interesting, how it developed during treatment. I did have friends that I could lean on, and I had a very supportive family, and I'm very thankful for that. But I did not, I did not join any support groups when I was in active treatment.
Mhm.
It was a thing that I discussed with my family, but and like we highlighted again, this is a very adolescent and young adult dominant cancer. It affects everybody of every ages, but it is very dominant in the AYA community. And it's really hard because you're going to these doctor's appointments, you're sitting in the waiting rooms, you're the youngest one there. It is very, very isolating. And I didn't feel comfortable joining a support group during treatment because it just made me feel more sick.
Mhm.
It made me feel even more isolated because, I see my friends getting apartments in the city and graduating college and starting on their careers, and I'm just, balled in a waiting room. And
Oh.
and so there was a lot of that
Mhm.
where I knew that a support group wouldn't help. However, I did meet somebody who had a cancer that was a different cancer, but a similar situation to mine where she had a very large tumor in her chest, and I used her as like a mentor.
Mhm.
And I it was the most helpful thing of my journey because again, I had a very supportive group of friends and family, but they are not able to meet me at a certain level that I needed someone that experienced something like this.
Right.
I can't share certain things with friends and family because they're going through their own different experience, like on the caregiver side, but
Right.
there is a difference there. So I was able to lean on this one person that helped, and I was able to share really deep, dark things with her that I was feeling, and it was very validating. She understood, she
Mhm.
resonated with it as well, and we became really close, and we're still really close. And I always tell her like she was like the main source of like keeping me hopeful throughout my journey because it is really important because it's very easy to lose hope, especially with
Yeah.
a cancer as rare as synovial sarcoma.
You're absolutely right. So I want to now switch it to a little bit of like navigating care. So how did you find the right medical team and the right treatment plan for you? And was there shared decision making implemented in that?
So when I first got diagnosed, I was at, just a local hospital by my house, and the surgeon there was the one and he was very transparent, and I do appreciate that. They didn't even try to treat me. They were
Mhm.
like, "We don't even know for sure what this is. We think it's a sarcoma. Um, we're not sure, but we can't treat you here. We recommend a second opinion." And my mom just, she's updating her friends as all of this is happening. And, thankfully she has a really supportive group on her end. And her friends started, referring, and they were like, well, we know these really great doctors at Penn, and, it's close to where we're located because I'm a little bit outside of Philadelphia. So, we were able to, and again, my mom being the aggressive woman that she is, was able to get me in with a doctor's appointment, I think within a couple days to a week.
Mhm.
And she literally drove the pathology reports over the bridge herself and delivered them to the doctors. And they were like, review this. Tell me what my daughter has. We need to treat her now. Like she's dying pretty much. And so they got it done quickly. And I was able to see a surgeon at the Penn's thoracic program. And I met this one surgeon who then referred me to another surgeon who ended up being my surgeon, Dr. Singal.
Mhm.
And I met with him, and he was very honest. And he said, this tumor is too large to operate on. We can't do it. We need to do chemotherapy first. I'm going to refer you to this doctor.
Mhm.
So I then was referred to the Abramson Cancer Program there and got started on chemo. From the time of diagnosis to when I started chemo, it was about a month. And I will say, with how rare and unknown this disease can be, I would say that's fairly quick. Um, and, there were a lot of appointments in between. We did get another opinion from MD Anderson, and they agreed that they would do the same treatment plan. So I was like, I'm going to stick to, where it's closer for me.
Mhm.
And, in between this, I'm also meeting with fertility doctors on whether I should freeze my eggs. And, at this stage, I'm 23 years old, and I'm not thinking about having kids. And it's a decision that I had to make,
Yep.
not being ready for it. And that's also another thing, especially with the, adolescent and young adult cancer community. You have to make so much more decisions other than what your treatment plan is. Like
Yep.
I'm deciding on whether or not I might have kids or not. And so I chose not to freeze my eggs and, take that risk and realize that if I do survive this, that's just something I'm going to have to live with in the future, and I'll decide it then. But
Mhm.
I'm not going to delay treatment 3 weeks and just to freeze my eggs, and then I end up not making it. I was already given 3 months. That would leave me with like 2 months. So
Mhm.
time was really of the essence. So like decisions had to be made
Right.
quickly. I had to decide if I'm going to have children in the future or not within a matter of 45 minutes. And that's, that's where the fight and flight mode really kicks in, because you're just making decisions and everything's out of your control and you're just hoping for the best.
Right. So how has your perspective on life changed in your priorities and relationships since being diagnosed and now a survivor of this?
hmm Overall, I would say the way that I see life is I'm very thankful. I'm very grateful. There's definitely challenges and chronic ailments that I live with because of it, but they're just reminders of how blessed I am to be here, be able to speak, and with how aggressive and rare this cancer was and is,
Mhm.
it's incredible that I'm still here.
Yeah.
And and as far as day to day, it's interesting. I'm pretty hard on myself actually in the day to day, and I try to remind myself to give myself grace, because there is a like a struggle that I have where, I'm like, oh, well, I beat cancer, so I have to keep doing things as great as that, right? It seems like, oh, you
Mhm.
beat stage 4 cancer. What can be more incredible than that? So there is this pressure that I
Mhm.
put on myself to just continue to do great things rather than, give myself credit for just like
Mm.
existing and being here. So that's just like there's like some little, there's some little mental battles that you continue to go through, and it's, I'm waking up every day and I'm
Yeah.
choosing like how I'm going to heal this time. Like there's no end in healing. We're continuing to do it. It's not linear. It's all over the place. And so there's definitely challenges. But overall, it's a reminder of course, how short life is and how truly anything can happen. And I'm just trying to, go about life learning to not let these things hold me back
Hmm.
and to, let myself know that it's okay to take risks, just because I do think there's also that like traumatic barrier where anytime I've done something big, it's weird the relation that a cancer diagnosis has with other little things in life that are not related to it. So
Hmm.
again, and I'm like 12 years out of my diagnosis, and then so it's incredible how much of an impact it still has. But
Hmm.
overall, I would say the impact is it's far better than worse, and just the way that I go about life and the how I see life is just it's just beautiful. It's beautiful, and I don't think I would have been able to see life the way that I did if I hadn't gotten sick.
Hmm.
And, I'm not really thankful for getting this disease, but I'm turning it into some sort of silver lining, right? Like
Hmm.
there's always good in something, I believe. So I'm trying to continue to find those things.
Right. And last question. So, looking back, what is one thing you would have wished you'd known earlier that could possibly help people in your same position in the past now?
One thing that I wish I had known earlier, I guess, treatment wise, I would have maybe tried to find alternative ways to heal my side effects, or just to like treat the side effects, because there were so many. And
Hmm.
again, everyone's body responds to chemo differently. I
Hmm.
had a very severe response to the Adriamycin and ifosfamide mesna regimen,
Hmm.
and I was admitted to the ER after every cycle, high fever, very neutropenic levels, had to delay chemo quite a few times, had to get blood transfusions, platelet transfusions, and it was very rough on the body. And I wish, and resources are much more accessible as they are now than they once were. We have people sharing reels on what they're doing and red light therapy and things like that. And
Right.
I was taking a lot of medications to heal my side effects that I don't think were I think my body was just like used to everything, where I just felt like I was taking so much medicine at the time that wasn't really helping. And my body was just almost too weak to find an alternative.
Hmm.
So if the resources are available to you, I would want to like look more into things like that.
Hmm.
And as far as things that even if I do know, there are things that I would like to advise are super helpful that I also did, but it's like being in this community, I'm reminded at how important these things are, and they're important to be, shared. And one is just to just have a mentor. Like if you're going through this diagnosis, it is so important to have someone to talk to that has also gone through something similar. Um,
Hmm.
you don't need to do it alone. And whether even if you have a supportive family, a supportive friends, anything like that, it's still really important to find somebody to talk to, confide in. It is very validating and helpful to have that source of hope, to
Hmm.
know that like life can exist after a synovial sarcoma diagnosis. Um,
Right.
I think that that's really important, and just also just you need to see a specialist. And
Yes.
this cancer is so different than a regular cancer. It's rare, and it's really important to see a specialist, to get a second opinion, third opinion. Like just don't take no for an answer. And it's really important to advocate for yourself. And if you have someone that can strongly advocate for you, like again, I'm very thankful I had my mom to fight for me. And it's really important because it's an aggressive cancer, and we need to be aggressive alongside it. And it's really important. And again, just know your resources, know what's available to you. That this community it's small, but we're supportive, we're here, and just don't lose hope, you
Hmm.
know.
Hmm. Well, thank you, Julie, for your honesty, your strength, and for allowing us to be part of your journey today and sharing it with us. We do appreciate it. Your story brings so much hope to everybody and everything that we've discussed today. So thank you so much for that.
Thank you. Thank you for giving me the space to do so.
Of course. So today we've talked about synovial sarcoma and the rarity of it and how important it is to have expert care because it does matter. We talked about our clinical guidance, lived experience that both shape different types of outcomes, but outcomes in general. Support systems are critical throughout the journey, extremely critical. We do need that, as we just heard with Julie, and that we don't want you to navigate this alone whatsoever. So we're going to wrap it up here because I do want to let us get some questions in. We're gonna kind of speed along this because I think we have 5 minutes left. Okay, yeah. So today's discussion brought together both the clinical expertise, the real patient experience, and we hope that combining both of them provide not only information, but also just reassurance about the support. We've explored the diagnosis, the treatment, and the real life journey of navigating synovial sarcoma. Most importantly, we hope that today reinforce the understanding of the importance of support and just having access to trusted information that really does matter. So thank you again to all of our speakers, our partners, and everyone who has joined us today. We do want to kind of wrap up now and go to our Q&A here. Hold on, let me just get to that. To our Q&A portion, we have about 5 minutes. So if we have any questions that have come through, we do want to address those. If there's anything else we want to talk about, I think we have a couple of minutes here to kind of get that started. Any questions, Tim? I can't really.
Yeah. So Julie, one question for you. So why is it so important for the synovial sarcoma community to come together, and what can patients do right now to help advance the science?
This is a really good question, Tim. Thank you. So it's so important for this community to come together because this cancer is so rare. And with rare cancers they're underfunded because they're not gonna make a lot of money, and treatments don't get pushed to the top. So it's literally up to the community to get funding to have clinical trials accessible for this disease. And there are ways that patients themselves, even patients that are out of treatment, in treatment, even those that are unfortunately no longer with us, that they can still contribute, their families can contribute. For instance, the Synovial Sarcoma Biorepository and Registry Program at CHOP. That is something that is funded by the Synovial Sarcoma Foundation, and it is a data collection of tumor tissue, patient data that is collected where they are actively working on research to advance treatment options specifically for synovial sarcoma. And it is open for anybody to register. You can learn how to do so on the Synovial Sarcoma Foundation website. You can even reach out to me. I mean, if anyone has further questions, happy to answer any of them. Julie at synovialsarcoma.org. But that's a really great start. And just understanding again what your resources are. We also have an international tumor board for the Synovial Sarcoma Foundation. So that's a thing where, you could Google Synovial Sarcoma Foundation, anything, but there are a lot of ways to get involved. And again, it's very important, especially for a rare cancer like this. It truly is up to the community to make the impact. It is up to, we are the answer. Patients are the answer to, advocate for ourselves and get this message out, and really make an impact.
I just want to touch on what you said, Julie. It's so important. All the things you said are so very, very important in that on our side of things, we're not at a loss of ideas, questions we want to ask, projects we want to move ahead. But funding is a challenge. Funding is a challenge just by general big pharma. Funding is also a challenge right now with NIH and CI. And so I think that small contributions can go so far. You have a simple question, and basically what we often have to do on our side of things is justify our idea. Does it make sense? And we have to do all this work to even bring the idea to the next phase of development. And so, one of the things that's come up is, what's the next exciting thing? And one thing that I've been interested in is mRNA vaccines and using it as a way to treat synovial sarcoma and other cancer and other sarcomas as well. And this is something that I literally have been working on for 3 years, knocking on Moderna, knocking on BioNTech. Can you support this idea? And then we found a small Belgian company that was interested in our idea, and we literally had the protocol ready to go, a year of work, all ready to go. And then the company was bought by BioNTech, and they shut us down again. But it's not to say that we stop. I think resiliency is like one of the most attributes that I'm most proud of. So you keep knocking at various people's doors, various companies, and you extend the efforts to other centers, and collaborations are really key and essential in our community as well. But getting the word out is important, because I don't think people realize that the challenge until you're in the middle of it, right? Like all of a sudden you realize, oh my God, synovial sarcoma is so rare. Is anyone studying this? And why are they not studying it? And so putting the voice of the patient is so powerful, and it doesn't become heard until you have to hear it, right? And so, but putting the message out there is important, and supporting rare cancers is something that is really essential in sarcoma.
Mm-hmm. Well, I know we are at time, but if people can still stay and you still want to answer a couple more questions, I have a couple more minutes to talk. I don't want to stop anything or kind of cut off anything, but if we have any other questions you want to address, but people, we are at time. Just wanted to bring that to our attention as well.
Yeah, Dr. D'Angelo, thank you so much for answering these questions in the chat. I don't know how specific or generic this one is, but one just came in. Have you seen any benefits from patients who use an ivermectin and fenbendazole combination protocol?
I've had a number of patients that have tried that, not under my specific guidance or supervision, and I have not seen it work. I think that these drugs were designed with a specific purpose, and cancer in general is much more complex than how these drugs can actually act. So no, I have not seen that be successful.
And then one other one for you as well. So if a Canadian resident was interested in receiving a second opinion at MSK, do you have an approximate idea of what that could cost? Ballpark is fine.
No, I don't. I can't answer that question, but we have an international program at MSK. I could put the link in the chat, and you can reach out to that group, and I'm sure they can provide a number of different avenues to consider a second opinion at MSK.
And do you have time for one more, Dr. D'Angelo?
Sure. One more. Absolutely.
All right. Thank you so much. Regarding new and experimental treatments for metastatic disease, where do you currently see the most promising treatment options? T cells, mRNA, and is there a difference between the different types of T cells? Is one T cell better than any other one?
Yeah, it's a great question. I tried to answer some of it in the chat, but yeah, so the most promising advancement to date has been with afami-cel, which is a T cell therapy that targets MAGE-A4, which is a protein that's found in most synovial sarcomas. as I alluded to this a little bit, the limitation of that T cell therapy is that it requires a specific blood type that's only found in about, I would say, a quarter of the population. There is an additional T cell therapy that's being worked on that has the same blood type requirement, but is able to target a different protein called NY-ESO. So NY-ESO is also prevalent in synovial sarcoma. So that T cell is called lete-cel, but that's kind of the same problem as the afami-cel, though, right? Only a quarter or a third of the patient population would qualify. Along those efforts with NY-ESO and MAGE, there's now efforts looking at antibodies, or what we call bispecific antibodies. Those drugs are promising because they are sort of off the shelf. You don't need to go through the process of making the T cell, which is complex and then also requires chemotherapy before you receive the T cell. Bispecific antibodies that target those antigens, those proteins, MAGE and NY-ESO, though, again, you're constrained by that HLA, because the problem is that those proteins are found in the cell, and in order for your immune system to recognize them, they have to be brought up to the cell surface by that specific, what we call HLA. Beyond that, there's a number of different efforts trying to better understand what I refer to as the biology of synovial sarcoma. What are the genetic changes that are happening within synovial sarcoma cells, and how can we leverage that to develop new therapies? So a number of different efforts ongoing from that perspective with a number of different targets. And then this question of mRNA vaccine has come up, it's come up in the chat a few times. I think that that's a very cool way to treat cancers. We've seen progress and advancements in a number of different cancers, pancreatic cancer, melanoma, and it's something that I hope will be able to bring to patients with synovial sarcoma, not requiring HLA, right? I think because that's like the other big mission, to expand promising therapies as much as possible.